All right, I'm Dr. Lee McGill. I'm a radiologist here at the Veranda, and I'll be discussing with you over the next few minutes about 3D mammography. 3D mammography is a new innovation that's been out in the last probably 2 to 3 years. It's really gained a lot of traction, mainly because of the huge benefit it has over 2D mammography. And the two main advantages of 3D mammography are, number one, a reduced number of callbacks, which is directly related to decreased anxiety for women, and second, and more importantly, a earlier detection of smaller cancers that can be treated earlier for women's health. Being able to detect a smaller lesion, which previously we may not have seen on a 2D mammogram. Also, some of these lesions may be the same size as they were the previous year, but now we can see them because of the technology, which allows a rotation around the breast so we can see more parts of the breast. And that means that when we send them to the surgeon, they may not be invasive at this point, because once a cancer is invasive, it's a little bit different treatment. 3D mammography, the compression here at the Veranda is usually for a lower amount of time and decreased compression overall compared to prior 2D mammograms. Callbacks are fairly common. We typically call back anywhere from 10 to 20% of women from screening mammograms. We're already seeing that number decrease now with 3D mammography. A woman, if she is called back, should expect really similar examination technique compared to the screening mammogram. She'll usually be in compression of the breast that's in question or concern. She may also receive an ultrasound to further evaluate that finding. And anywhere from probably 10 to 15% of these women will undergo a biopsy. So a very small amount of women actually undergo biopsy from the original workup. So the 3D technology basically allows the abnormality that we see for biopsy to be viewed in multiple projections. Again, the way the machine works, it scans over the breast. So now we can see the lesion that we're going to biopsy in several projections. We can target that, and actually the computer does the targeting, taking away most human error, and allows us to directly target the lesion of concern and give that area local anesthesia and take a few small pieces of it for the pathologist to look at under the microscope. It's all done at the Veranda, right? And it just takes probably 10 to 15 minutes to actually do the procedure from the time they get in the room to the time they leave. It'll be the same technologist usually that performs your screening mammogram or your diagnostic mammogram. They'll be the one that gets you set up for the compression, for the test, and the procedure. And then once they've done that, I come in and introduce myself and talk to you more in detail about what we're going to do. Again, the procedure takes 10 to 15 minutes, and once it's over, there's almost no post-procedural problems. We don't have a lot of bleeding or pain or infection with these procedures, and the patient can go home the same day. They don't typically need any type of anesthesia during the procedure. Usually within 3 to 5 days we have the results back. Anytime we have a biopsy, whether that lesion or that result is benign, whether it's malignant, whether it's inconclusive at the time, no matter what the biopsy result is, we discuss that directly with the patient and their family members as soon as we get the result back that day.